And I'd like now to introduce Ohad Regev, who's an MD PhD student at Ben Gurion University of the Negev. And he will discuss sex differences in fetal head growth that are associated with autism. Thank you, Ohad.
Hello everyone, my name is Ohad. I'm from Ben Gurion University. I'm doing my PhD thesis on investigating fetal development using prenatal ultrasound. So today, the diagnosis of ASD is usually conducted during the age of 3 or 4 years old, when the core symptoms of the disorder are noticeable. Nevertheless, initial signs of ASD may emerge much earlier during life, as seen previously during this conference. One of these early signs, which has been previously shown, is abnormal growth of both the brain and the head in autistic children. Numerous studies show that children with autism are born with either a normal or smaller head size, followed by an overgrowth during early childhood, during the first months and years of childhood. This overgrowth was mainly seen in the frontal lobe and temporal lobes, as well as in some studies, including a study by Professor Dinstein, which showed extraaxial CSF volumes, mainly above the frontal lobes. Other studies, which investigated neurodevelopment among ASD children, showed that children with ASD have abnormal neurodevelopment that might start during prenatal life. They showed abnormal maturation of neurons, abnormal movement of neurons, which are supposed to do this maturation during the first and second trimester of life. Other studies showed that children with autism have a lower concentration of growth hormones in the blood right after birth, which might also affect brain development. These findings suggest that this overgrowth we see during the first years of life may be some kind of a reaction or an adaptation to this prenatal growth in the brains of children with autism. Thus, there's an emerging ASD prenatal literature which is trying to investigate this abnormal neurodevelopment during prenatal life. To date, 5 studies were conducted on this topic, which showed conflicting results, with 2 studies showing that children with autism might have smaller head circumference, and that typical developed siblings of children with autism might also have smaller head, while other studies show that actually children with autism have larger heads or wider heads compared to controls. Nevertheless, these studies had considerable problems. They had very small sample size. Many of them didn't account for potential confounders, such as familial effects or the sex bias. And specifically, these 2 studies, which showed larger heads, were conducted on 90% males and compared them to controls which had 50% males, 50% females, which will show later on as a very great effect both on autism risk, as seen yesterday, and on biometric measures. And finally, these studies were done on different gestational ages, which also make it difficult to compare the findings. Thus, we decided to conduct our own study in order to complete these limitations. The study was based on the databases of Clalit Health Services and of the National Autism Research Center, which have extensive information both on autistic children, their socio-demographic information, and clinical and genetic data, which allowed us to conduct a very comprehensive study. Our study focused on basic biometric measures, which are taken usually during the second and third trimesters of pregnancy. These measures include head growth, which include head circumference, or HC, head width, which is BPD, and 2 body measures, which are abdominal circumference and femur length. In order to conduct our study, we took children from the NARC database, randomly sampled them, and in all we had 174 children with autism. To each child with autism, we matched 2 types of controls in order to take into account both genetic and familial factors which may affect autism risk. One control was their typically developed sibling, which was closest in age, and the second was typically developed child from the general population, which was matched both on sex, age, and ethnicity. All in all, we had 528 children in our study. Examination of clinical and socio-demographic characteristics of children with autism with both controls show that children with autism and the typically developed controls had a sex ratio of 1 to 4, as usually seen in autism, while their typically developed siblings had a ratio of 1 to 1. We didn't see any other significant differences which may affect autism risk between the groups. Next, we examine the biometric measures between males and females, once again seeing that males across all groups have much significantly larger biometric measures compared to females. Once again, showing us that the sex difference must be taken into account when examining prenatal growth. So our results. When we examined the whole cohort, we saw that children with autism, and both children with autism and their siblings, have narrower heads compared to TDP controls. We also saw that this head was proportionally smaller versus other body parts, which means that this head abnormality we saw is not due to a different age or fetal growth, but only focused on the fetal head. Next, due to the sex differences we saw earlier, we decided to look into the head growth for females and males separately, as can be seen here. So the blues are the males and reds are females, and we can see that males have, once again, larger biometric measures than female. When we compared the ASD cases to both controls, we saw that both ASD and their siblings have narrower and elongated head shape, which is also called dolichocephalic, which we can see here compared to normal head shape. While in females, the head was proportionally smaller compared to female controls. Another finding we saw is that while both ASD and their siblings had smaller and narrower heads during the second trimester, their siblings, which can be seen here in an empty circle, managed to close the gap by the third trimester, leaving ASD cases behind. And our last findings were that when we examined biometric measures and the correlation with autism severity using both DSM categories, ADOS, and cognitive score, we saw once again sex-specific correlation with these clinical outcomes between males and females, as can be seen here. The fetal head shape we saw is in line with previous findings, which showed that children with autism have mostly abnormal growth in the frontal lobes, while they have a decrease in the volume in the temporal lobes, which once again give this dolichocephalic shape. Another study which confirms our findings is this study concerning CSF volume, which once again showed that extraaxial CSF volume is mainly above the frontal lobes, which once again can lead to this head shape we see. Our finding concerning that ASD fetuses remain with a smaller head compared to both population controls and their siblings are once again in line with these findings of head growth, which show that children with autism are born with smaller heads during their birth, which is followed by this overgrowth. So what we think is that happens is they're born with these smaller heads, and then some kind of a fixation to what's going on during prenatal life bring this of a really fast overgrowth later in life. A last finding concerning this sex-specific head shape and its correlation with autism severity is also in line with previous studies, which showed sex-specific brain abnormalities in males and females with autism during postnatal life, as well as a sex-specific correlation to clinical severity. And that's it. Thank you very much.
Thank you so much, Ohad, for that fascinating talk.